A lot of those diseases, they weren't fatal if they were treated on time and if they got the proper medication and the proper care. I do believe that they could have saved quite a lot more of them.
Catherine Corless has no knowledge of vintage medicine. She once worked as a secretary in a textile factory, but she quite clearly thinks she has a body of knowledge that is superior to that of professional medics and science historians.
A lot of those diseases, they weren't fatal.
If that is the case, then why are infants and children still dying of those same diseases in the 21st century? She hasn't an iota of a clue that those diseases and conditions still kill infants today, and would be still killing thousands more, each year, were it not for the introduction of various vaccination programs. Moreover, many of the diseases that killed infants and children in the past are still not curable. These vaccinations were not available at the time when the Tuam Children's Home was in operation. Every competent medical researcher knows that children under 5 years of age continue to die at rates that are multiples of those for various groups of children and adults, right up to the age of 64. In the past, children under the age of 5 died in numbers that were quadruple the number of people who died aged over 75. It was not until relatively recently that the infant mortality rate began to decline. Mrs. Corless has a level of knowledge that is less than zero, of pediatric pathology, etiology, epidemiology, and medical statistical analysis. Yet, she feels competent to issue retrospective prognoses over the heads of those who are educated in medical matters, and without any consultation with qualified nurses or doctors. It is astonishing that such nonsense can be passed off as genuine history in the 21st century.
I'm not really an historian as such.
Birth certificates do not contain information regarding the health of the baby when it was born. It appears Anna Corrigan has managed to read something that has not been written. Alison O'Reilly's caption under the photo of the birth certificate states that the child was born in the Tuam home. However, the place of birth on the photo is given as the Central Hospital in Galway. Corrigan also states that her infant brother deteriorated from being normal and healthy to a congenital idiot. If she had looked up a dictionary for the meaning of the word congenital, she might have realized why the police, nor any other authority, could have taken her allegations as credible.
In a time, now long ago, journalists were required to check that the information given to them was factually correct. Also, we might have a reasonable expectation that journalists would be given a basic education in a broad range of subjects, especially the English language. Alison O'Reilly provides us with the very exemplar of the huge drop in educational standards that has occurred over the course of the last few decades. O'Reilly, a supposed professional wordsmith, appears to be unable to use a dictionary, is completely unaware of the linguistic phenomena of semantic drift and the euphemism treadmill. Perhaps she has such an education, but there is no evidence of it in her writings about mother and baby homes. These writings are all riddled with elementary errors, are factually dubious, but most of all are a fabrication, designed to instill hatred. In this example, O'Reilly falsely claims that none of the deaths at the Tuam home was certified. That's pure baloney. They were all certified by a medical doctor. Moreover, she laughably claims that the person named as the informant on death certificates was the person who certified the death. If that fiction were true, then here is the evidence that Princess Anne certified the death of Queen Elizabeth, and not a medical doctor.
The people in the homes who were signing the certificates were former residents. Ina Rabbit was a resident of the home. I wouldn't have expected her to be educated. She had no medical experience.
O'Reilly misinforms her readers that the use of the word idiot on vintage medical documentation was used in the same manner as she uses the term today. However, it's a lie. Semantic drift is the linguistic term for the change in meaning of words over time. while the euphemism treadmill explains why certain words and terms must be changed. Listen to this Airbus flight computer annunciator.
20. Retard. 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 Retard.
The annunciator instructed the pilots by telling them to retard 4 times. The word has now become a commonly used insult, abbreviated from the medical term mental retard, and now further abbreviated to just tard. It is a Latin word meaning to make slow, and is used by Airbus because of its distinctiveness in a multilingual environment. The word idiot, along with the terms imbecile and moron, were old medical terms describing various stages of mental disability that came to be used by the general public as insults for one another.
When these medical terms came to be used as insults, medics were forced to change them. They were replaced with the term mentally retarded, and that also became an insult, as did mentally handicapped and every other term describing mental disability. We now have the term mentally disabled, but when it also becomes a popular insult, it will have to be changed. This never-ending process of change is known as the euphemism treadmill.
The term clown is not an insult, unless it is used as such. Airbus are not using the word retard as an insult. Terms like idiot, imbecile and moron were not used as insults on historical medical records. They are redundant medical terms that require explanation, which is the duty of all competent historians.
Here is another example of a fabricated story by O'Reilly. Accordingly, it is based on absolutely no evidence. She imagines that porridge was shoved down the throat of several children. She has taken the phrase, written on one death certificate, aspiration of food, probably porridge, and used it to conjure up a falsehood, that many children had food shoved down their throat. Rather incompetently, she contradicts herself by also claiming that they were starved at the same time.
Aspiration is the medical term for the accidental inhalation of foreign bodies into the lungs. Note accidental. It is not evidence of shoving anything down anybody's throat. Had that happened, it would be indicated on the death certificate, and certified by a coroner. O'Reilly writes mainly for the British Gutter Press, and their Irish editions. As the nickname implies, the Gutter Press has no regard for truthful reporting.